I'm Dr. Frita, and today I'm giving you 5 weird diabetes symptoms that show up in your feet. Do you respect your feet? I'm serious. Do you respect them? You certainly use them up. You walk on your feet. You dance on your feet. You run on your feet. You use your feet up for your balance and your stability. You even stub the pinky toes on your feet and they still forgive you. So do you respect your feet? Well, of course you should. Not only for the reasons I've mentioned, but also because your feet can literally give you warning signs about your health, including diabetes. Yes, I'm serious. Your feet can warn you that you might have diabetes. This is a big deal because according to the CDC, over 38 million Americans have diabetes, yet 1 out of every 5 doesn't even know it. That's a problem because we know that diabetes is a leading cause of heart disease, of strokes, of poor circulation, of nerve damage, of poor wound healing, of amputations. And diabetes is the #1 cause of kidney failure. I'm a board certified kidney doctor, so this bugs me. But don't worry, I have some good news. The good news is that diabetes is actually treatable. Yes, whether it's through diet, through exercise, through lifestyle changes, or through medications, we as physicians can help you to manage your diabetes. But in order to get your diabetes managed, you must first know you have it, right? So in addition to getting regular checkups from your doctor, one of the ways you can find out if you have diabetes is to listen to your feet. And today I'm giving you 5 weird diabetes symptoms that show up in your feet. Keep watching. Listen, I love talking to you and us having these conversations through my videos, but you know what else I love? Talking to you one-on-one. So if you would like to have a consultation with me one-on-one, I do provide a telehealth concierge service, and I can talk to you from anywhere in the world. We have a conversation, a video call. I do a full history. I give you a first opinion. I give you a second opinion, and we can talk about kidney disease. But remember, yes, I'm a board certified nephrologist, but I've also been board certified in internal medicine, pediatrics, and obesity medicine. And so there's a whole lot of subjects that we can cover, and we can cover them one-on-one from anywhere in the world. It doesn't matter. So please, if you're interested, click the link in my description and let's have a telehealth concierge appointment. I'm Dr. Frita. Please go ahead and give this video a like as we get started because I'm about to share some evidence-based medical information about diabetes and your feet. And please share this video with the people you care about. When it comes to diabetes, your feet definitely can give you huge clues that you have it and that you might be having some serious complications from it. Why? Because diabetes can cause you to have high blood sugar or hyperglycemia, and this high blood sugar is actually toxic to your body. Specifically, it can be toxic to your blood vessels and toxic to your nerves. Well, when it comes to your feet, if you have damaged blood vessels, then that gives you poor circulation and potentially poor wound healing. And if the diabetes damages the nerves in your feet, that can give you a peripheral neuropathy, right? And it can lead to a numbness and a tingling. When I think about diabetes and feet, of course, I think about many of my patients because, again, I am a kidney doctor and diabetes is the #1 cause of kidney failure. But I think about one patient in particular. We'll call her Susie. Susie was a wonderful, vibrant young lady who happened to have diabetes, and she had numbness and tingling in her feet because she had diabetic foot disease. So, of course, I would counsel Susie that it was recommended that she not walk around barefoot and that she not walk around with open-toed shoes because with her diabetic foot disease, doing so could cause her to have some injuries that could lead to complications. Well, Susie, like most young ladies, enjoyed fashion. She enjoyed having open-toed shoes, and she didn't always want to wear shoes. She wanted to walk around barefoot, especially in the summer, right? Well, because Susie did not listen to her feet, she ignored my advice and she did walk around barefoot and she did walk around with open-toed shoes. And ultimately, she ended up getting a sore on her foot that she didn't feel because she had diabetic neuropathy. That sore became a bigger wound. It got infected. She developed gangrene. And ultimately, Susie had to have many of her toes amputated. This story, unfortunately, is not that uncommon, but it stresses the point that it is important for you to listen to your feet when it comes to diabetes. All right, let's get to it. Here are 5 weird diabetic warning signs and symptoms that show up in your feet. Number 1, tingling or a pins and needles sensation in your feet. Yes, this is a big one because if you have this tingling, it could be an indication that the diabetes has caused nerve damage or it's given you a diabetic neuropathy. So here's what it feels like. It literally feels like pins and needles or like a numbness in your feet, sometimes a buzzing. Have you ever been sitting on your feet, maybe reading a book or watching TV, and then when you stand up, it feels like your feet are asleep and they have this like numbness and it feels like someone's in there with pins and needles pushing and pressuring? Yes, that's exactly what it feels like. The issue is that it could be a warning sign that you have diabetes and that you have diabetic foot disease in the form of peripheral neuropathy or diabetic neuropathy. Why is the tingling of the feet weird? Well, everyone has had feet that have fallen asleep. If you are sitting awkwardly and you get up and then you've got the tingling, okay, that happens. But it becomes weird when you start to get this tingling even without applying a lot of pressure to your feet. And when it is prolonged, when it lasts a long time, and when it's affecting the bottom of the foot, when it's affecting the soles, when it's affecting the toes, and you have no specific reason, that's when it's a red flag. So what do you do next? Consult with your doctor right away if you're having this prolonged tingling of the feet, because this could be one of those weird diabetic symptoms that show up in your feet. Question: what's one thing you'll do today for better foot health after watching this video? Number 2, electric zaps or strange buzzing. Yeah, this definitely is a symptom you don't want to ignore. It feels almost like lightning, like a surge of electricity in your feet. And then there's like a weird buzzing that happens, almost like a phone is vibrating in your feet. You don't want to ignore this symptom because, again, it could be a warning that you have diabetic foot disease. Why is it weird? Because most of the time, if someone gets like a weird shaking or buzzing in their foot, they might just think it's a muscle contraction and they just, might put it off. But you don't want to ignore it because, again, it could be your feet talking to you about diabetic neuropathy. What should you do next? Consult with your doctor or healthcare provider right away. Weird diabetic foot symptom number 3, oddly smooth, shiny skin with hair loss on the toes or feet. Okay, so a lot of us want to have nice, shiny, smooth feet, but if you all of a sudden are having really smooth, light, shiny skin on your feet, and you notice that you don't have any hair on your toes, no hair on the top of your feet, even if the rest of your legs are still hairy before you shave them, then this definitely could be a warning symptom of diabetic foot disease. Again, diabetes and having high blood sugar or hyperglycemia can be toxic to your blood vessels and it can cause you to have peripheral artery disease. When this happens in the feet, well, then you don't get proper blood flow to your feet, proper oxygen, proper nutrition, and this can cause you to lose hair on your feet and it can make them smooth and shiny. Why is it weird? Because a lot of us want smooth, shiny feet. We put Vaseline on our feet. We don't want a bunch of hairy toes. So it's weird because what might be aesthetically pleasing to some could actually be a dangerous warning sign. This takes me back to my patient Susie, the example I shared. She had smooth, shiny feet. She probably thought it was a good thing, but yes, she had poor circulation. And so when she developed that sore, she didn't feel it due to the neuropathy, the nerve damage, but also that sore did not heal well. The wound did not heal well on her foot because she had poor circulation. The poor circulation caused her to have smooth, shiny feet with no hair. The poor circulation also caused her not to be able to heal the wound, which ultimately led to amputations. So having this diabetic symptom of smooth, shiny feet with no hair on your toes or on your feet is definitely a problem. What should you do about it? Well, definitely consult with your doctor. Also, make sure that you don't walk around barefoot, that you don't walk around with open-toed shoes. Consult with your doctor about diabetic foot shoes. And they're making diabetic foot shoes pretty cute now for both men and women. Make sure you take care of yourself and don't let vanity outweigh your health. Question: how often do you actually examine your feet for changes or abnormalities? Please comment down below. 4, the wet socks feeling without wearing wet socks. Now, this one is crazy because for this symptom, you literally feel like you have on a bunch of wet socks, or like you've stepped in water, or like your feet are sweating profusely inside of your shoes. But when you take your shoes off to check them out, your feet are completely dry, okay? They feel like they're damp and they're cold and they're clammy, but you have dry feet. The wet socks feeling, even when you don't have on wet socks, is a very important symptom because it could indicate that you have nerve damage from high blood sugar and diabetes. Yes, it could mean that you have diabetic neuropathy. Why is it weird? Well, you know why it's weird. You're sitting there and you could just swear that your feet are wet or sweating, but even you yourself, when you touch them, you see that they're dry. And it's a perfect example of how your mind can play tricks on you when it comes to nerves and neuropathy. What to do next? Well, of course, you want to consult with your doctor, and you want them to check you out to see if indeed it is diabetes that's poorly controlled. You want to find out if it's diabetic neuropathy, or if there's some other nerve issue, like do you have multiple sclerosis, or do you have poor circulation? Either way, you don't want to ignore this as just another weird, strange symptom. You want to check it out and find out what's going on with your blood sugar. To learn more about blood sugar and diabetes, make sure you check out my video, Diabetes Explained, right after you watch this video. I love coming on here and talking to you about various health issues, but if you want to continue the conversation and have a one-on-one consultation with me, I do offer a telehealth concierge service. That way, I can talk to you from anywhere in the world about your personal health issues. I get a full history and I'm able to give you personal medical information. And so if you're interested in having a one-on-one with me, please click the link in my description or visit my one-stop shop, dr.frita.com. Number 5, loss of balance or coordination. Now, this is a tough one. For this symptom, you may feel unsteady on your feet. You might have numbness and tingling in your feet. And when you walk, you might not really exactly feel like you know where your feet are, okay? You kind of feel uneasy, off balance. And this is because you could have a peripheral neuropathy or a diabetic neuropathy, and that's what's causing the tingling and causing you not to feel comfortable when you walk, and so you have an unsteady gait or an unsteady walk. If you have this diabetic neuropathy or nerve damage, you can also have a loss of proprioception, meaning you have a loss for an awareness of where your feet are. And this, of course, can change your balance and make you feel uncoordinated. Why is it weird? Because even though you're kind of stumbling and feeling like you're clumsy or weak, you might actually have perfect strength in the muscles in your feet. It's just the nerves. Also, with all the stumbling and the way that you walk, you may seem like you're dizzy, even though really you're not dizzy, you're not lightheaded, you just have the diabetic neuropathy. What do you do next? Of course, you consult with your doctor and ask your doctor about the proper shoes. You want diabetic shoes that give you proper support. You also want to ask about physical therapy. Can doing some physical therapy or learning certain exercises help you to balance properly? Now, I know I keep saying what to do next, consult your doctor, but let's talk about which doctors you should be consulting. You always consult with your primary care physician, like your internist or your family doctor. You also want to ask about seeing an endocrinologist, especially if you have diabetes that is poorly controlled. An endocrinologist is a physician who specializes in diabetes. Another doctor to see, a foot specialist, either a podiatrist or an orthopedic surgeon who specializes in feet. Some other doctors you may need to see, a vascular surgeon. If you have diabetes that has caused you to have poor circulation, then consulting with a vascular surgeon can be helpful because there are different procedures they have that can help to open up those arteries and to reintroduce a good circulation to your feet. And if you get to a point where you may actually need some type of amputations, okay? If you get gangrene and sores and you need some portions of your foot amputated, you want to consult with a vascular surgeon who can do some sparing surgery. In other words, instead of going straight to the top and taking off a bunch of your limb, a really good vascular surgeon can help to preserve as many of your toes as possible and do it in a safe way. Certainly consult with a board-certified vascular surgeon. Another helpful doctor, a neurologist, or a doctor who specializes in the nervous system, the brain, the spinal cord, your nerves. If you're having some of this diabetic neuropathy, then a neurologist can help you to manage that. And if you're getting recurrent foot infections, you may even need to see an infectious disease specialist. There you have it. These are 5 of the weird warning signs and symptoms of diabetic foot disease. If you found this video to be helpful and informative, please be sure to like it and to share it with someone you care about. Again, it's important to remember that diabetes can show up in strange ways in your feet. Having high blood sugar can cause nerve damage. It can cause circulation damage, which can lead to symptoms that are not always obvious. So make sure you listen to your feet and respect your feet. As always, I appreciate your support. I thank you for watching, and I want you to do your best to live your healthiest, happiest life. I'm Dr. Frita.